Hello, doctors. Ready to conquer one of the most classically tested topics on step 1? Pneumonia is not just about lung infiltrates, it's about matching the right bug to the right patient. And trust me, the Usmle loves to give you a clinical vignette and ask what's the most likely organism. So let's break it down by age, risk factors, and radiology buzzwords. And this is going to be packed, fast, and fun. Let's start with pneumonia by age group. Neonates under 28 days think of vertical transmission. The key bugs: group B Streptococcus, E. coli, and Listeria. That is why we add ampicillin to cover Listeria, especially when they are floppy and febrile in the first few days of life. Next, infants between 1 to 6 months. Common culprits are RSV, Chlamydia trachomatis, and Bordetella pertussis. RSV causes wheezing and bronchiolitis, while Chlamydia gives a weird twist, that is afebrile pneumonia, often with a staccato cough. From 6 months to 5 years, viruses dominate. You will see RSV, parainfluenza, adenovirus, and also strep pneumoniae, especially if it is lobar on chest x-ray. After 5 years and into adolescence, we shift to more atypical bugs like Mycoplasma and Chlamydia pneumonia. Think of Mycoplasma as a college dorm bug. It's common in young adults too, from 18 to 40, along with strep pneumo and Chlamydia pneumoniae. From age 40 to 65, you are dealing with aspiration and comorbidities. Bugs like strep pneumo, H. influenzae, and anaerobes pop up here, especially if there is smoking or poor dentition. And then the elderly over 65 years are at higher risk of severe pneumonia with strep pneumo, influenza, anaerobes, and gram-negative rods. Always think broader coverage here due to higher mortality. Here is a great mnemonic to remember the top drugs across the boards. Sick moms cannot leave hospitals peacefully. And that is strep pneumo, Mycoplasma, Chlamydia, Legionella, Haemophilus influenza, and Pseudomonas. Now let's talk about special risk groups. Number 1 is alcoholics. Think of Klebsiella, current jelly sputum, and anaerobes from aspirations. And then comes cystic fibrosis. The lungs are chronically damaged, so Pseudomonas, Staph aureus, and Burkholderia are the causative agents. Next is smokers and COPD patients. You will often find Haemophilus influenzae, Moraxella, and strep pneumo. The next, IV drug users. Watch out for Staph aureus, especially with hematogenous spread. Aspiration pneumonia is very important. What causes it? Usually anaerobes from the oral cavity like Bacteroides or Fusobacterium. The buzzword here is altered consciousness. Think of alcoholics, stroke patients, seizure episodes, or people who are intubated or very elderly people. And the position matters here. Very important. Upright patients aspirate into the basal segments of the lower lobes, while supine patients get it in the posterior upper lobes or superior lower lobes. Again I repeat, posterior upper lobes or superior lower lobes. Another USMLE favorite is a post-viral bacterial pneumonia, especially after influenza. Within 1 to 2 weeks of flu, if someone worsens again, think of superinfection. The classic trio is Staph aureus, which can cause a cavitary pneumonia, strep pneumoniae, and Haemophilus influenzae. If it's severe, you better cover MRSA empirically. Now for those final nuggets. If you think of rusty colored sputum, that's classic for strep pneumo. Currant jelly sputum, think of Klebsiella, especially in alcoholics. Cold agglutinins and atypical pattern, it is Mycoplasma. If it is lobar consolidation, most likely strep pneumo, and diffuse interstitial pattern on the X-ray, and that can be viral or atypical causes. Okay, let's wrap this up. If you are asked about a young adult in a dorm with pneumonia, go with mycoplasma. Then floppy febrile newborn, think of GBS, E. coli and Listeria. Aspiration pneumonia, think of anaerobes and body position. Post-influenza pneumonia, it is probably Staph aureus. Watch out for cavitations. And always remember those buzzwords: currant jelly, rust sputum and cold agglutinins. You have just powered through one of the most testable pneumonia breakdowns ever. So the next time the chest x-ray shows up on a screen or a step 1 question mentions a college student with persistent dry cough, you will know exactly what to think. Keep that momentum going. You are doing amazing. One system at a time, one bug at a time. You are becoming the physician you were meant to be. Let's keep going strong. This is Dr. Ram here from MedMadness. Thank you so much.